This 4-day step-down training is meant to build the capacity of MDFC's members to ensure contingent and emergency preparedness plan for nutritional food insecurity. The initiative seeks to effectively respond and protect the nutrition status of the population, especially vulnerable groups such as children and the elderly in emergencies. Speaking to participants, Maria Damfa, a Senior Program Officer, School Health and Nutrition, Directorate of Health Promotion and Education, gave an overview of the activity, noting that the training is an essential tool to prepare for emergency response, to mitigate challenges, ensuring affected victims have access to safe nutrition.
Nutrition in emergency is critical for mitigating the negative effects of crisis, preventing death and protecting people's right to nutrition. When disaster strikes, population groups that are already malnourished prior to emergencies are more vulnerable to illness and death. The communities affected by emergencies are more likely to suffer from malnutrition due to lack of insufficient food, water, lack of access to health service, civil insecurity, poor sanitation, and insufficient public service delivery.
Preparing you to respond or be in the frontliners when it comes to emergency, I think is very important. It's very, very important. To us, just like I said before, it's a matter of policy. And then we are happy to be associated with this activity, and we thank the stakeholders that are involved in it and tell them for us it's a matter of policy, and I think it's very relevant.
The Program Officer, National Disaster Management Agency, Mbasi Sane, emphasized that disaster always comes with unprecedented challenges, such as displacement of people, food insecurity, and the risks of malnutrition, illness, as well as death due to hunger, particularly affecting children and the elderly, who are the most vulnerable groups.
The knowledge and the know-how will help us as the planners to inform decision on the relevance of having the right nutrition, not just to give out, but having the right nutrition when we are responding in an emergency. This will help us to prevent, mitigate, and prepare for our response.
So the training is basically a step down. So the TOT was done in Tendawa some time ago. So those who were trained at that ground are the ones going to facilitate this training here. So the MDFTs that are already trained here now will also be used at the community level to intervene during emergency situation.
The Deputy Director of Health Promotion, Sanjali Trawale, and Nutrition Specialist UNICEF, Yankuba Saho, respectively, highlighted the importance of the training, saying the capacity building will equip and prepare participants for effective response when disaster strikes.
Anytime emergencies evolve, the MDFT are engaged. I guess you have been participating in food distribution. So it's important that we have these basic ideas, these basic principles. Red Cross will also facilitate some of the principles we should employ during humanitarian crisis.
Every player is important, so, and coordination is important. This will also help us in coordinating. So that's what I say. I'm very happy that we have a lot of players here. That is very, very important. The more we sit together and discuss, the more we consolidate our efforts. So it's very, very important. So we are very happy to support this, and we will continue to support the step-down training to the communities because they need resilience building.
The Regional Health Director in the Upper River Region, Dudu Sanyang, called on participants to take the training seriously as they are first responders when disaster occurs, noting the scheme's important focus on the nutritional aspect to save the children and elderly.
So this training is important. I think this training is also going to provide you the opportunity to prepare people for emergencies. Usually when we are preparing people for emergencies, I wonder whether we look at the nutritional aspect the way we should look at it. That's another opportunity that you are going to gain from this training. What are some of the little very important things that we need to do to prepare our people for emergencies?
Disaster disrupt regular community practice and displace population, causing food insecurity and malnutrition, which increased during the period. Officials disclosed that over the years, there have been significant improvements in nutrition indicators in the country. Authorities believe community-based approaches can effectively address nutrition challenges through the involvement of residents in planning, implementation, and evaluation of response mechanisms. Saidou Camara, reporting for GRTS News from Basse Upper River Region.